I want to thank the chairwoman. Today's hearing continues this committee's ongoing work to bring oversight and accountability to the Trump administration's relentless attack on people's health care, whether it be attacks on the Affordable Care Act, Medicare, or Medicaid. Since day one, the Trump administration has engaged in a concerted effort to undermine, weaken, and outright eliminate health insurance coverage for tens of millions of Americans. I heard what my colleague, the ranking member from Guthrie, said, that I guess he doesn't think that this administration is sabotaging anything. But, you know, the problem that I have here is if someone's on the right ideologically and says, look, the government shouldn't be involved in health care, shouldn't get involved with health insurance, people are on their own. If you said that, and I'd say, okay, I understand, you want to get rid of all the health insurance, you want to get rid of all this is not the government's role. But the problem is I hear my colleagues on the other side, including the president, suggest otherwise, that they want to cover everyone, that they want to help people get health insurance. Well, I don't see that at all. I think if you look at this practically and not ideologically, it is clear that fewer people have health insurance, that their essential benefits are being cut back, they're not being covered. So to suggest that somehow they're not responsible for that, I think is not true. They are responsible. It's a concerted effort to cut back on people's health insurance, their benefits, what kind of coverage they have. And our witness today is the administrator for the Centers for Medicare and Medicaid Services, CMS, Seema Verma, who is the administration's point person on these actions. I think she has a difficult record to defend. During her time as the administrator, healthcare costs have gone up and health insurance coverage has gone down. And thanks to the administration's policies, the number of uninsured Americans increased by nearly 2 million people from 2017 to 2018, rising to 27.5 million uninsured. And between December 2017 and this June, more than 1 million children lost health coverage through either Medicaid or the Children's Health Insurance Program. And these are, bipartisan programs. Why is this administration making it more difficult for people to get coverage, and particularly kids? These are very disturbing trends, and unfortunately they could get even worse if CMS and the Trump administration are successful in pushing their harmful policies. The Trump administration is actively supporting a lawsuit that would overturn the Affordable Care Act. This would strip health insurance away from tens of millions of Americans and would allow insurance companies to once again discriminate against people with pre-existing conditions. The administration has expanded junk insurance plans that are not required to cover essential health benefits like hospitalization, prescription drugs, and emergency care services. The Trump administration is also placing extremely burdensome, in some cases illegal, hurdles in front of Medicaid beneficiaries. These unnecessary roadblocks are certainly causing pain for low-income families, as more than 1 million children lost health insurance coverage through either Medicaid or CHIP between December 17 and June of this year. These disturbing numbers show that the Trump administration's policies to drive people off Medicaid, tie them up in red tape, or scare them into not even applying for insurance in the first place are working. And I'm deeply concerned by the Trump administration's ongoing attempts to impose illegal work requirements, waivers on Medicaid beneficiaries. These requirements are not only cruel and costly, but they're a clear violation of both Medicaid statute and longstanding congressional intent. Unfortunately, these illegal actions have been rightfully defeated in the courts, but the Trump administration refuses to give up. And the Trump administration is also not giving up in its ongoing attempts to sabotage the health care of millions of Americans through the ACA. In some instances, the proposals have been so extreme that even Administrator Verma has raised a red flag. In an internal memo dated August 2018, she wrote that several administration proposals at the time would, and I'm quoting, cause coverage losses, further premium increases, and market disruption. And the memo concluded that 1.1 million Americans could lose their coverage. And I have repeatedly requested Ms. Verma provide the underlying analysis discussed in that memo. If the Trump administration is pursuing a policy that would have harmful impacts on billions of Americans, Congress and the American people have a right to know what exactly that analysis shows. To date, I have received a 1 1/2 page response that answers none of my questions. So under Ms. Verma's leadership, CMS is following the rest of the Trump administration in stonewalling legitimate congressional oversight requests. And I'm appalled by the flimsy, non-responsive letters this committee has received back from CMS, many times well past the deadline. As I wrote in a letter to both the Secretary Azar and Administrator Verma last week, obstruction of the committee's legitimate exercise of its oversight responsibilities is unacceptable, and if it's continued, may necessitate the use of additional measures, including compulsory process. So Administrator, you cannot flout this committee's constitutional duty to conduct oversight. I appreciate your being here today. That certainly says a lot that you're here, and I don't want to take away from that. But the stonewalling of our oversight requests have to end. And with that, Madam Chair, I yield back.